about a bunch of different things today. Breast reduction for women and men, liposuction, as well as arm lifts. And later we'll be taking your calls, answering your questions, anything you might have. Here's the phone number, okay? You guys write this down. 415-561-8753. 415-561-8753. We'll also be posting the phone number to the doctor's office, so again, be ready to take that down. And remember, before we get started, any advice we give you today, you want to consult your own physician. All right, welcome back to the show,
Nice
Dr. Mealy.
Thank you.
Thank you again for joining us. Let's talk first about breast reductions in women.
Okay.
First off, this can really change a woman's life, right?
It can, because breasts that are overly large or out of proportion are hard to dress, they're hard to work with, they're hard to exercise with. So a lot of my patients come complaining of neck pain, back pain, shoulder pain. They'll get ruts from the bras. They tend to wear bras that are a little bit tight anyway, just to keep everything in place. They find it hard to find bras in the first place.
Exactly.
Hard to find clothing that's proportionate.
And you know, a lot of women actually think, maybe I just need a better bra and that's going to solve the problem. So a lot of people don't get this problem taken care of when they really should, because it does cause a lot of pain and back problems too, right?
It can, yeah. And the back problems make this one procedure where I have some of my happiest patients.
Exactly.
Because I can get rid of that for them. And it's dramatic in that a lot of times folks who have that neck, lower neck, sort of upper back pain, it's gone in the recovery room after surgery.
Feels so good. How is the surgery performed?
So the surgery is performed outpatient, so you usually can go home the same day, or if it's a larger reduction, a lot of times I'll keep people overnight just to watch them. It's done under anesthesia, so you get the anesthesia, goes right in through the IV, next thing you know, you're done. And a lot of folks are feeling better already.
What about scarring on that procedure?
There are scars, so the scar, what the scar is doing isn't so much reducing as lifting the breast.
Right.
So when we do a reduction, we're also doing a lift at the same time.
Okay.
The scars give me access, so I can remove the extra tissue. The majority of it is removed from the outer part of the breast, a little bit from the inner part. That way we can maintain some cleavage, some fullness in that area.
And do you have to take the nipple off and move that, or is there a new way to do it?
Normally we're leaving the nipple attached. So the nipple and the areola are left on the breast tissue underneath so that it can maintain both sensation and the blood supply. And that's sort of moved like a little breast implant underneath the skin. The scars come from reforming the skin, refashioning it, and reshaping it, so we get the lift and a nicer shape.
Because a lot of women think, if I'm going to get this reduction, I'm not going to have any more sensation, but that's wrong.
That's unusual. I can't say it never happens, but it's rare.
Okay, good.
Yeah.
And
the time when it happens all the time is sometimes where the nipple is very, very, very low. And in order to reduce the breast enough, we have to remove what would normally be the pedicle, the part that supports the nipple. Then we use it like a skin graft, but that's very rare.
Okay.
More common in men, though.
Oh, really? Yeah, we're going to talk
men, we're
about
not
that
trying to preserve breast mound. We're trying to flatten things.
Exactly. And let's talk insurance, though, because a lot of women may not know they can go and maybe their insurance will pay for this because of the pain and back pain and problems.
A lot of times it will. Normally, it really helps if you've gotten a note from your primary doctor, if you've had any physical therapy, anything to try and alleviate the symptoms. That's usually good evidence that it is a real problem.
Yes.
And that it helps us in terms of getting approval.
Let's look at some pictures, doctor. Take a look.
Sure.
All right, first one, what do we got?
So this is a breast reduction, someone whose breasts are almost down to their waist.
Wow.
And afterwards they're able to lift all of that up.
That's perfect.
And you can tell just from where the elbow is how much higher the breast mound itself is, as well as the nipple. So the little black squares are where the nipple is sort of pointing south beforehand, and it's back in the front where we want it to be afterwards.
Nice and perky. Let's take a look at another picture.
So this is a different patient front view. But same idea, very low, long breasts. We've reduced the skin. So the scar runs underneath the breast in that fold.
You don't see it at all. Yeah.
And so that one's pretty well hidden. There's one that runs around the nipple and the areola because we've moved it. And in cases like this where it's very, very low, often I don't need to make the vertical scar.
Oh, that's good.
So that's the one that tends to bother people the most.
And you can see that they regain the fullness at the top as well.
Quite a bit of fullness.
Yeah.
There. Yeah. Once in a while, I can't get that fullness there, and it may seem crazy, but we'll use a small implant while we're doing a reduction to give us that fullness at the top.
Oh.
But a lot of the times we can get nice fullness just by repositioning what's there.
All right, what about this one?
The reason we can't always get fullness way high is because the breast needs to stay behind the nipple.
Oh.
So we want the breast mound to stay behind that nipple.
Because you don't want the nipple facing down again. Okay.
So in this case, if you look beforehand, she's got some fullness up at the top.
Yes.
So I don't really have to worry about it so much afterwards.
Right, because it looks great afterwards too, so no problem there. And last picture.
And this one, probably the largest lift out of them all. Hers are way, way low. And again, we've moved it up. In this case, I did use a vertical scar to help reduce the width, because you can see how far over to the side the breasts go. That allows me to remove sort of some central skin to bring the sides together and narrow the base.
Wow.
So again, the incision's kind of, they call it an anchor incision. It goes around the areola, down and along the bottom.
And did she have a lot of back pain?
She had a lot of back pain, neck pain, and you know, most people worry about the scars more before the surgery than after.
Absolutely.
Afterwards, she just felt better and wasn't really concerned about the scar. Just happy that things fit and looked nice in clothing and in a bra.
And pain-free.
Yep.
All right, for more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. We're going to take your phone calls when we come back on Body Beautiful. Talk more. 415-561-8753 is the phone number. We'll be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.